I feel humiliated that the children have got to do what they have to do. And I'm angry.
It angers me every day of the week to see her like this. It upsets me. Like you can see her get upset now. I don't see why she should have to go through this. She's done nothing wrong.
Oh, you're fine. You're fine. And they don't see beyond a bright coloured jumper. They don't look at you, they don't ask, they don't want to know.
I'd lost a lot of what people call normal life. I know you can get a disability through all sorts of reasons. But I believe this was an unnecessary disability.
Now, where did this all start? Where has this come from? Where does this arachnoiditis, what does it do? And I just wanted to know, I wanted to delve into it.
The story of adhesive arachnoiditis is one of the great medical tragedies of the 20th century and one of the best kept secrets. The suffering it has produced is both cruel and relentless, and on such a large scale that it's almost impossible to think that many physicians still deny that it's a significant problem. It's less unexpected, however, when you realise that unlike the vast majority of illnesses, adhesive arachnoiditis is caused by the very medical procedures designed to help cure patients. Not surprising then that the majority of doctors we spoke to simply refused to take part in this programme, using the excuse that we don't see this as an issue of any great importance. Well, it's certainly an issue of great importance for the millions of arachnoiditis sufferers worldwide who have been left disabled and in constant pain. But it's all too easy just to blame the doctors. It has been said that doctors can only diagnose what they know, but if they are never made aware of the risks of causing adhesive arachnoiditis through procedures which they believe are safe, then how can the situation ever change? And because of threatened litigation, this sole state of affairs has turned into a finger-pointing exercise which is essentially unhelpful to all concerned. Over the next hour or so, we're going to look at the subject of adhesive arachnoiditis from all angles. From the doctors who've struggled to raise awareness of it, the pharmaceutical companies who have been accused of producing chemicals that cause it, the government departments that don't really understand it, and the patients who have been left to suffer with it. To understand more about arachnoiditis, we need firstly to look at the workings of the central nervous system. Dr. Charles Burton of the Low Back and Neck Care Centre in Minneapolis is widely regarded as one of the world's leading authorities on this disease.
The most precious asset that any of us have is our intact nervous system. And our intact nervous system is surrounded by membranes. The closest membrane is the subarachnoid space, which is the pia and the arachnoid. And the subarachnoid space creates the spinal fluid that bathes the spinal cord, covers the brain. The brain rests on a cushion of spinal fluid, and the spinal fluid is produced by the subarachnoid space. In the lower areas, it ascends up over the brain where it's absorbed into the venous system. This is the nutrient for the brain. It is the support of the brain. I refer to the subarachnoid space as the salum sanctorum. It is the most precious and fragile environment in the human body.
And yet, for most of the last century, doctors have defiled this salum sanctorum, injecting a range of chemicals into it for various purposes. One of the main reasons that doctors injected chemicals into the spine was to perform a spinal myelography. This procedure involves injecting a so-called contrast medium into the spine, which then shows up as white on an X-ray. This gives doctors a clearer view of the spine from which they can diagnose a range of problems. Way up in the Western Isles of Scotland lives Mike Feehan. He developed adhesive arachnoiditis some years after having a number of invasive back procedures, which include myelography, and has spent the last 3 years conducting his own research into this chronic condition.
I found myself on the Back Talk site, and I was reading Sarah Smith's paper, and I see this word, arachnoiditis. Wow, what's that got to do with backs? Spiders' backs didn't balance out. So I had to click on it, and there it was, and I'm reading this paper, and I'm reading the symptoms, and it's me. It's me that I'm reading about. It's me that's got the sciatica. It's me that's got the pain in the muscles of my leg. It's me that's waking up every morning and just lying there to wait for a leg to wake up with me, you know, can be rather...
But what is the link between Mike Feehan's symptoms and the myelography he had years before? Let's look at what can happen when a contrast agent is injected into the back, and how, up to 20 years later, it can cause severe adhesive arachnoiditis. The spine is divided into 4 areas: the cervical vertebrae, the thoracic vertebrae, the lumbar vertebrae, and the sacrum and coccyx. Now let's focus in on the lumbar region. We can see the bone structure, and in the middle, the cauda equina, which is actually a continuation of the nerve roots. It is into the cauda equina that the contrast agent will be injected. This procedure is called a lumbar puncture. If we look at a cross-section of the cauda equina, we see that there are 3 layers which include the dura mater and the arachnoid membrane. And contained within these layers are the spinal nerves, which in turn are bathed in spinal fluid. Let's see what happens in some patients when we perform a lumbar puncture, injecting a contrast agent through the dural and arachnoid layers into the spinal fluid. The following can take weeks, months, or even years to occur. First of all, there is an inflammatory response to the foreign body, which produces scar tissue. Spinal nerves become enlarged and swollen, and the space between the nerves disappears. Over time, the nerve scarring increases, and the nerves adhere to each other and to the arachnoid and dura. As more scar tissue continues to be deposited, the nerves can seem to become part of the dural and arachnoid membranes. This is full-blown adhesive arachnoiditis. Throughout this program, many people refer to arachnoiditis and adhesive arachnoiditis as the same thing, but in reality there is a difference. Dr. Charles Burton.
Arachnoiditis is a very common phenomenon. Probably most people have some arachnoiditis. Everybody who's ever had any viral disease or mild meningitis or trauma or spine surgery has arachnoiditis. It is rarely of any clinical significance. Adhesive arachnoiditis is a significant pathologic entity. Adhesive arachnoiditis means that there is scar tissue, abnormal scar tissue, invading the subarachnoid space and producing scarring of nerves. It's very similar to the concept of fire. Fire can be a candle on a table. Fire can also be a conflagration, destroying forests and homes. What's the difference? The difference is in the degree. One is limited, controlled fire of no real consequence as far as adversity, and the other is potentially of significant adversity. So, to me, that's the difference. And what we're really concerned about is not arachnoiditis. We're concerned about adhesive arachnoiditis.
In 1999, Dr. Sarah Smith completed an international patient survey with regard to clinically significant adhesive arachnoiditis. As part of this survey, she asked about patient symptoms. The 10 most common symptoms reported were pain, numbness or tingling, sleep disturbance, weakness, muscle cramps or twitches or spasms, stiffness, fatigue, joint pains, balance difficulties, and loss of mobility. In addition to these, there were many other symptoms reported, including bladder, bowel and sexual dysfunction, increased sweating, heat intolerance, flu-like symptoms, frequent infections, weight gain, trouble swallowing, difficulty thinking clearly, dry eyes or mouth, dental problems. The list goes on.
Oh, my body feels tight and twisted. My legs feel as though they're wrapped round one another. And it's very difficult to walk.
I can't wear tight-fitting clothes around my waist, or if I
wear anything that hasn't got elastic in. I have to undo the zips. As I say, I have to wear a full shoe. I find a trip a lot more. I can't seem to judge if there's a slight alteration in the level of a floor, I trip on it.
My arm was affected, and it felt as if someone had poured boiling oil on my arm. I can only describe the pain like that. It was extraordinary. I was putting cold compresses on, flannels, anything to the burning sense. If anyone's had a burn, you know what it's like.
Bobby Adams worked hard from the age of 15. She was a lively, outgoing person who lived life to the full and who loved to dance. But now, after 13 years of arachnoiditis, even the simple task of making a cup of tea can prove to be an agonising experience.
Oh, look at me. Lee, do you want to finish this brew, though? Come and give us a hand. When the spasm starts, I call it a spasm. A lot of people call it a flare-up. To me, it's a spasm. And I start shrinking down and the pain starts coming. It's like if you could get hold of a thick wire cutter and literally force it into an S-bend or a shape it's not supposed to go. That's what happens to me. And I go further and further down and shrink smaller and smaller. And the more I try and push myself up, the more pain I get and the worse I get until I just end up a total S-bend and I have to go to bed. And there's nothing I can do about it.
Well, I've lost my career. I've lost my social life, private life. You lose friends.
I have a son. I couldn't play football with him. I couldn't go running around with him. I missed out on a lot of things that other fathers take for granted and other sons take for granted. My son lost out as well. And of course my wife loses out. A lot gets put on her that shouldn't be put on her.
And I feel very sad for the boys because I'm not a mum. I can't go on the trips with them. I can't help out in school. And the worst thing is when people say, but you look so well.
So we can see that the symptoms of adhesive arachnoiditis relate to the whole body and not just to the spine. And for many, as Carol Ringham just said, the most frustrating thing is that you can have adhesive arachnoiditis, and although you have symptoms, on the outside you can look so well. This can lead to problems with doctors, benefits agencies, and even family and friends, as we'll see a little later. There are many causes of adhesive arachnoiditis, and the majority of procedure-related ones have to do with some foreign substance getting into the subarachnoid space and causing scar tissue. Unfortunately, as Charles Burton said, the subarachnoid space is such a sensitive area of the body that even blood is considered a foreign substance. Therefore, any invasive back procedure where the subarachnoid space is at risk from insult has the potential to cause adhesive arachnoiditis. It's amazing then to think that the main diagnostic procedure in terms of the spine over the last century was one which relied upon deliberately injecting a foreign substance into the subarachnoid space, the myelogram.
I now know, through reading about arachnoiditis, that it was the myelogram that probably did all the damage. But the myelogram, when they told me about it, was going to be my godsend. It was going to be the final test that would prove whether I had something wrong with my back or not. This is what they told me. And I wasn't to worry because they did thousands of them.
The myelogram, or myelography as it's alternatively called, is an invasive procedure undertaken to help diagnose backache and problems with the spinal cord. During a myelogram, the patient lies on their side on a special tilting table, and after a local anaesthetic in the lower back, the contrast agent is injected into the subarachnoid space. We can see it here in blue. Once the contrast agent is injected, the table is tilted and the fluid runs up and down the spinal cord, allowing x-rays to be taken of different areas. Relatively few myelograms are performed today, but it was once a very common diagnostic procedure. The number of patients worldwide who have had a myelogram runs into millions.
Well, initially, when myelography first came into being, it was actually air myelography, and they then started using substances such as thorotros, which was radioactive, which you can appreciate wouldn't be very safe. But then went on to use something called lipiodol, which was oil-based and which was highly toxic. And on the basis of only 2 animal studies, they decided to exchange that with myodil, which was actually only marginally less toxic. And myodil was recognised as early as 1950 as being extremely toxic by a neurologist called Jaeger.
The paper that Rudolf Jaeger published was concerned with the irritating effect of iodized vegetable oils on the brain and spinal cord. One of these substances is called iofendylate, the only ingredient in the contrast agents pantopake and myodil. In 1947, Jaeger carried out animal experiments from which he drew the following conclusions. Ethyl iodophenylundecylate, or iofendylate, is extremely toxic, even much more irritating than similar emulsions of the iodized oils previously used. Inflammatory reactions in the spinal subarachnoid space following the injection of various iodized oils have been reported by many clinicians. The lesson to be learned from this study is that iodized oils should be instilled into the subarachnoid space with due regard to their potential irritating property, and to prevent ill effects, they should be removed, or as is sometimes termed aspirated, completely whenever possible, either before or immediately after the surgical procedure.
And I just cannot understand why doctors think that they can inject something into that sealed system without causing harm. They can't get it all out. This aspiration is a nonsense. They might get a little bit, but they're always going to leave a deposit behind.
The use of iofendylate for the purpose of myelography was clearly the primary reason for people to be disabled with clinically significant adhesive arachnoiditis, mainly disabled with constant intractable pain. In the United States, it was pantopake. In Europe, it was myodil. With these substances disappearing from the scene, and the word is, quote-unquote, fell into disuse, as opposed to being recognized as being toxic and purposely limited in use, they fell into disuse.
In the early 1950s, the Swedish government decided that they shouldn't use myodil any longer and its use was discontinued.
We wrote to the Swedish National Board of Social Welfare, who replied, "The Stockholm School took a stand against the use of these oil-based contrast media at an early stage, and they were hardly ever used in Sweden. Considering the number of post-myelographic arachnoiditis that are now reported, this may seem to have been a wise decision."
However, in this country, it was still being used up until 1987.
At which point it was taken off the market by its makers, pharmaceutical company Glaxo Wellcome, now GlaxoSmithKline. GlaxoSmithKline refused our invitation to take part in this programme, but did write to us answering some of our questions. They also sent us their standard letter regarding their position on myodil. GlaxoSmithKline has every sympathy for people who think that they have suffered as a result of the administration of myodil. However, the symptoms and issues surrounding arachnoiditis are complex, with current medical opinion indicating that people's suffering is most likely due to their original condition, degenerative back disease, or surgery and other medical procedures which were undertaken. It should not be overlooked that by definition, people who had myelograms were already back sufferers. Although this isn't always the case. Until her myelography, Lisa Rowe had never had a back problem.
I had a myelogram which I didn't need to have, as it turned out. I had pain at each side of my stomach. I found out it was an ulcer. They thought it was referred pain from the spine at the time, so they did a myelogram. It didn't show up anything. They operated and found it was an ulcer. But the myelogram left me with the problems that led to arachnoiditis.
The great majority of patients were patients who had was referred to as the failed back surgery syndrome. The failed back surgery syndrome basically means somebody who had had surgery, multiple surgeries, had not done well. And it became evident that the reason that these people, for the most part, were not doing well is because they had a condition which turned out to be scar tissue enveloping the nerves, obliterating the subarachnoid space or scarring the subarachnoid space, and that this was in fact adhesive arachnoiditis. What was frustrating was the discovery that the primary reason for this was the introduction of myelographic agents. In the United States, Pantopaque. In other countries, Europe, Myadil. That in fact, the use of these agents for diagnosis was producing disease far more significant for these patients than the original disease for which they were being treated, which was usually a herniated disc.
In their letter, Glaxo go on to say, Glaxo Wellcome supplied Myadil to meet the needs of a knowledgeable and specialist medical profession who had to take into account side effects before using the product on a case-by-case basis. All pharmaceutical products have side effects which have to be weighed up by doctors against the benefits which the products bring, and this judgment clearly has to be based on the medical knowledge available at the time. As soon as Glaxo became aware of the possibility of arachnoiditis in 1971, it included warnings to that effect in the form of inserts in the product's packaging. However, let's remember that the only ingredient in Myadil was iofendilate, and this was shown to be extremely toxic by Jaeger in 1947.
The longer term consequences were less obvious because sometimes you can have a delay of up to 10, even 20 years between the exposure to the chemical insult and the onset of symptoms. And this causes problems in recognising the link between the cause and effect.
Basically, there really is no mystery in regard to this entity. It's just having adequate information. Unfortunately, many physicians are ignorant of the existence of the entity. Some have heard of the entity and don't really understand it. And if physicians don't really understand it, how can they communicate this to patients so that the patients can understand it? They really can't. And lack of information, misinformation, has really characterized this whole issue over the many decades.
To get more information, we asked Glaxo some additional questions. Did Myadil contain the chemical iofendilate? They answered, iofendilate is the only ingredient in Myadil. Did Myadil differ in any way from the American product Pantopaque? No answer. What safety and toxicity tests did Glaxo carry out in the development of Myadil, and were they conclusive? No answer. In an edition of the Sunday Post, Scottish, July 15, 1990, headline, Search for Dye Victims, Glaxo were quoted as saying, the possibility of contracting arachnoiditis resulting from the use of Myadil has been known for many years. Do you still agree with this statement, and if not, why not? No answer. Referring to Martin Sutton of Glaxo, you yourself have stated recently that Myadil did not cause adhesive arachnoiditis. If your company believed this so firmly, why did it not clear the issues up once and for all in court rather than choosing to settle out of court with Myadil victims? No answer. Although Myadil has not been licensed for use in the UK since the late 1980s, we believe that it is still licensed for use in other countries. Could you give us a list of countries to which you currently supply Myadil, if indeed you do? They answered, GlaxoSmithKline does not sell iofendilate or Myadil anywhere in the world. It has been suggested by various sources that when Myadil was first sold by Glaxo, it did so at the request of the UK government. Can you confirm or deny this? They replied, the UK wartime government asked manufacturers to produce iofendilate in 1944. Glaxo agreed to do so at that time. In July 1995, after 4 years of legal proceedings over Myadil, Glaxo Wellcome reached a settlement with a group of plaintiffs. This was done without any admission of liability by the company, which took the view that a settlement was more equitable and in the best interests of all parties, not least in terms of the legal costs which would have been incurred. The terms of the settlement involved a lump sum payment of $7 million and took into account 425 plaintiffs who had submitted their full cases, including medical information. In 1995, Glaxo settled 425 Maido-related cases, but the payments were inadequate and the company withheld vital paperwork, said one newspaper. Legal proceedings against Glaxo were initiated in 1991, when several thousand sufferers tried to come together and form a single group action. Things immediately got bogged down when medical and legal teams on each side couldn't agree on what constituted a myeloarachnoiditis victim. The wrangling was an omen of what was to come, and there was disbelief when the criteria determining who could proceed against Glaxo stated that arachnoiditis had to appear at more than one level of the lower back. This immediately excluded 3,000 of the 3,500 claimants, and only 425 were allowed to proceed. All the rest had their legal aid withdrawn, effectively preventing them going any further. But this idea of levels of arachnoiditis didn't convince Mike Feehan, who decided to pay a visit to respected arachnoiditis researcher Professor Antonio Aldretti.
If you inject something at one level, then you're going to have injury only shown in the X-rays or the MRIs or CAT scan myelogram only at that level. And that may be true, but here again it depends on how much they injected in the case of surgery. Now, surgeons are used to see the arachnoiditis from surgery, which is by far more cruent, more invasive, to have 2 or 3 levels involved, because they usually operate at least 2 levels, because rarely do they operate just 1 level, and they might, even in fusions, they might find 3 or 4 levels involved. But let me make a quotation that I wrote in my book, say there's not a touch of arachnoiditis. Like you can say you have a touch of pneumonia, so once you have arachnoiditis, you have arachnoiditis.
Member of Parliament Tim Collins has recently formed an all-party committee to lobby the government on the subject of arachnoiditis.
I think it is true that we've got some very powerful groups who have had an interest, if you like, in hoping that this issue would go away. That's included big pharmaceutical companies, it's involved senior people in the medical profession, and it's involved successive governments. If we're going to get an end to this process of buck passing and everybody trying to point the finger at somebody else, we actually have to have an independent inquiry which can look through all the papers over many decades, establish exactly who did make mistakes and apportion liability accordingly. The other advantage of taking an all-party approach to this is that hopefully we can actually say to the government of the day, whoever they are, look, don't think that you are actually going to get a huge amount of criticism for taking a decision to set this up, and don't think, for that matter, any one of the political parties is going to lose out, because we're all equally guilty, but hopefully equally we can put ourselves together and actually re-establish public confidence in the process. What I'd also say to the medical profession and to the pharmaceutical companies is that there is no longer any possibility of pretending to people that this problem didn't occur. There's no way this can be swept under the carpet. People have got to accept their responsibilities. Maybe the people who took the decisions are long since retired or in some cases dead, but the medical profession is still around, those pharmaceutical companies are still around, and I actually think they would do their own public image a huge amount of good if they came forward, stuck their hands up and said, yes, there was a problem and now we're interested in sorting it out.
In the meantime, water-soluble agents were starting to be used, agents such as metrizamide, Conray, Dimer-X, Omnipaque, Amipaque and various others, and these have a lower potential for causing problems, but in actual fact can still be toxic, especially if given in certain concentrations.
Amersham, who produce Omnipaque, sent us the following statement. Omnipaque is available in concentrations of 140, 200, 240, 300 and 350 milligrams of iodine per milliliter in Europe. These differing concentrations are used according to the type of exam, technique and patient weight, age, cardiac output and general condition. The concentrations of 180 to 300 milligrams of iodine per milliliter were approved by health authorities for intrathecal use in myelography based upon rigorous clinical trials in animals and humans. The clinical trials in support of Omnipaque were conducted in Europe, Canada and the United States in accordance with applicable regulations and compared iohexol with commonly used ionic contrast media. In the submission data, Omnipaque was shown in controlled and uncontrolled clinical trials to be safe and efficacious in radiographic procedures requiring positive contrast enhancement of the cerebrospinal fluid in lumbar, thoracic, cervical and total commular myelography. There is supportive data for the assertion of safety of Omnipaque in myelography from both the adverse event reporting data and the literature. Over the last 4 years, there have been an estimated 1.2 million myelographies performed in the United States alone. During this time, Amersham Health has received only one adverse event report, which was classified as arachnoiditis, and this case is inconclusive. A search of peer-reviewed medical literature conducted utilising an outside service has revealed the following factors to be true regarding arachnoiditis and contrast media for myelography. 1. The combination of surgery and oily contrast media contributes to the incidence of arachnoiditis. 2. Previous spinal surgery contributes to the incidence of arachnoiditis. 3. The use of modern non-ionic contrast media, such as Omnipaque, virtually eliminates the occurrence of arachnoiditis. Based on the review of the literature and the drug safety profile, we do not have any evidence linking the use of Omnipaque with the development of arachnoiditis. But there are reports that Omnipaque may not be as safe as it's claimed to be, and there is a growing dossier of patients who claim to have endured side effects similar to those associated with Myadil. As one newspaper reported, medicine safety campaigners are demanding a government inquiry into claims that the drug called Omnipaque may leave patients in pain for the rest of their lives. Omnipaque is an X-ray dye which replaced Myadil, a similar pharmaceutical product which has already been blamed for causing untold misery.
No doctor has ever sat me down and said, Mrs. Nevitt, you have arachnoiditis. It was only because I had the car accident did it prompt me to get a copy of my medical records and see the diagnosis down there on paper. My GP hasn't told me. When I checked my GP records, all the records regarding the treatment that I'd had between 89 and 92 had disappeared from my file. My GP acknowledges the fact that I have arachnoiditis, but I don't discuss the issue with her. I just discuss the issues of pain control. And all I was being told was it's nerve damage, but not what nerves were damaged or how they've been damaged. Nobody's ever told me the truth. I'm just considered a medical embarrassment. They're aware of what they've done to me and they just don't want to discuss it. They know they can't cure me. And they're quite happy for me to go away and not question the system. I found out it was iohexol, which is a water-based dye, which doctors say is safer. But the Royal College of Radiologists doesn't say that. In fact, the water-based dyes are more toxic than Myadil ever was. And that's in the report they did for the Myadil case.
Well, nowadays, of course, a myelogram is not very often used. They've actually been superseded by MRI scans. So from that point of view, there's no worries as to myelograms still being performed. Occasionally they need to be performed with people who've got hardware in their back. They've got pedicle screws or some sort of cage or something put in to stabilise the back, and that can cause artefacts on the MRI, so they might need a myelogram, but in general most people are offered an MRI scan.
These days many patients are trying to become informed about their treatment, and there are now patient support organisations to help them do this. People are sent information from their hospital about the risks involved in their treatment, and there are websites from the likes of Bupa which have information on treatments and their associated risks. But in our research we found no mention of the risk of arachnoiditis after a myelography from any of these sources. And if the patient isn't told of the risk, how can they give informed consent?
Why wasn't I informed as their next of kin? And that to me just really angers me. It really annoys me that these companies or whoever it is that's doing it, these doctors, are getting away with this. Because they're not informing the patients, and they're not informing the patients' families of the implications and the possible repercussions of what's going to happen. Why should my wife have to go through this now? Why should Carol have to have this? Why should these boys have to have it?
the advent of epidural steroid injections using toxic materials, particularly depomedrol in the United States, depomedrone in Europe, with the primary toxic material being the glycols, the ethylene glycols used in these preparations, has supplanted iofenolate as the primary reason for disability due to adhesive arachnoiditis, in my opinion. Again, with myelography, it's sad when a diagnostic study creates disease much greater than the disease for which it's being used to diagnose. With epidural steroid injection, it's a sad situation where the epidural steroid administration, which is meant to be a benign treatment for back problems, creates disease which is far in excess in regards to disability and incapacitation than the original problem for which the epidural steroid is being used. It simply doesn't make sense.
Epidural steroids have, in my view, no place in the management of particularly chronic back pain because they only provide very temporary benefit and they have a risk of causing arachnoiditis. And even in acute back pain, there are American guidelines which suggest that they're not recommended. So other alternative treatments which would be more broadly based in terms of physiotherapy, oral treatments for pain and so forth would be more appropriate than using an invasive treatment.
Pharmacia, who produced depomedrone, state quite clearly in their packet insert that, due to its potential for neurotoxicity, depomedrone must not be given by the intrathecal route, that is, into the subarachnoid space. They also say, depomedrone is not recommended for epidural, intranasal, intraocular or any other unapproved route of administration. Furthermore, Pharmacia state that if administered intrathecally, then one of the possible adverse reactions is arachnoiditis. However, what the doctors say is another thing entirely. A caudal epidural is a very safe procedure involving an injection into the base of the spine using cortisone and anaesthetic. It has no relation to the epidurals commonly associated with childbirth. Occasionally, pain is felt during the procedure, but this is temporary and improved immediately afterwards. There are no serious side effects. Our success rate is 67%.
Unfortunately, many people who do epidural steroid injections are people who routinely do epidural anesthesia and spinal anesthesia using rather innocuous substances. They don't realize that when they switch to something such as depomedrol, they need to have a much higher degree of accuracy and placement of this. I see many patients who've had spinal surgery who do not have an epidural space, who are referred for epidural injection, have epidural injection, and have substances such as depomedrol or depomedrone directly instilled into the subarachnoid space, which is sheer folly.
In terms of epidural anaesthetics, in their use in normal childbirth, in healthy mothers who are having a normal labour, then I don't see that they have a place in that management.
Dr. Marsden Wagner, former Director of Women and Children's Health for the World Health Organization and advisor to UNICEF, said injections into the spine to relieve labour pains were fraught with peril. He voiced his concerns after the Sunday Express revealed that thousands of patients have been disabled by a whole range of spinal injections. Dr. Wagner says the childbirth jabs known as epidurals can cause serious problems including death, brain damage and fever, and can even harm babies. Such injections are increasingly popular and are used in 15% of all British births and up to 50% in some hospitals. But Dr. Wagner said women are not being warned of the dangers. They are being told they are safe. This is a lie. If they knew the real dangers, why on earth would they put themselves or their infants at risk, he said.
There's other means of pain relief for childbirth. And this is what gets me so cross. And what I'm getting from a lot of the mothers are, I wasn't given any choice. or I was bullied into having one. I didn't, when I did my birth plan, I said I didn't want an epidural, I wanted a natural birth. But I was forced, in inverted commas, into having one. Caesarean sections. Oh, well, you could have it under an epidural. It's better to have it under an epidural than a general anaesthetic. Yet the people that are giving those epidurals, when I've spoken to them recently, they didn't even know they could damage both the mother and baby. I've had to show them the proof myself. And I'm only a bloody midwife, ex-midwife, that had to give up work because of my condition. The medical profession want educating. The government know it's happening. The drug companies know it's happening. Why can't everybody be told?
Common pain-killing injections used in childbirth have left thousands of women disabled or paralysed, the Sunday Express can reveal. Experts claim the damage caused by widely used epidurals, injections into the spine, are one of the NHS's most closely guarded secrets. They predict that when the full extent of the scandal emerges, it will be as shocking as the controversies surrounding thalidomide and HIV-infected blood given to haemophiliacs. Concern is now so great that MPs are calling for an urgent inquiry into the use of spinal injections. About 170,000 epidurals are carried out every year. Recently there has been a huge growth in the numbers of women given epidurals as a painkiller during childbirth.
With regard to research, research has been carried out on epidural anaesthesia. There's a couple of good reports on that. But when I actually got down to the details of it, it sounded quite impressive. 16,000 women and only 20% of them had any problems. But when I got down to the bottom of the report, researchers only actually saw 23 women in all that group. And if you'd complained of backache prior to pregnancy, then you weren't included in the figures. You were deemed to be okay. What kind of research is that, where you see 23 people out of 16,500?
Many physicians don't believe that this is a disease, and secondly, they want the patients to get used to that disease, to deal with it.
As a counsellor, I'm supposed to listen and listen and do some more listening. I think the doctors would be better off doing that as well. Because when you hear somebody who says, I have back pain, 9 times out of 10 it's painkillers, go home, rest. And they come back, I've still got back pain. Okay, referred on to, maybe not, depending on what part of the country you're in, depending on the queue, referred on to a specialist. But while all these people are in their own state of denial, and while they're not being honest with themselves, how can they be honest with their patients?
The problem is that people aren't suspicious of it. So the GPs who are the front line aren't necessarily suspicious. Their index of suspicion isn't necessarily raised where it should be by factors in the history such as a myelogram or epidural injections. So they're not making the connection, they're not looking for the condition, so they're perhaps attributing non-specific symptoms to other conditions, or they're just quite often rating the patient perhaps as neurotic or even hypochondriac.
If you try and publicise arachnoiditis and you talk to news people or TV, any media guy, the first thing they do is pick up the phone and dial a neurologist. And the neurologist is going to tell them that it doesn't exist. He's going to tell them that these people are barking mad, that they're all a bunch of layabouts. That's obscene.
Well, radiologists are the ones that's supposed to read this, although neurosurgeons, some of them learn to in their training, learn to read, and others depend exclusively on the reports, written reports by the radiologists, and the radiologist does not identify it, and the neurosurgeons, the pain doctors, the orthopedic surgeons obviously do not want to go against the opinion of the radiologist. And so the disease gets left in limbo.
Carol Ringham has been diagnosed with fibromyalgia, although her GP believes that she has arachnoiditis.
I just need a name to what's wrong with me. And I think if you have a name to what's wrong with you, rather than a bad back, because people think a bad back, you're swinging the lead, and a bad back just doesn't cover what's wrong. It's not just a bad back.
Quite often people are getting diagnoses of conditions such as fibromyalgia, which is a non-specific diagnosis, and in fact it sometimes is regarded as a wastebasket diagnosis when a doctor doesn't really know what's going on. And we do get people who are diagnosed with both arachnoiditis and other conditions such as multiple sclerosis, systemic lupus, fibromyalgia and various other conditions, and it would seem unlikely that they have two major conditions at once, so that it's more likely that the condition, all the problems could be attributed to arachnoiditis. So that for those who haven't got that diagnosis, they may be being investigated for systemic lupus, rheumatoid arthritis, various different problems, and may not actually be given a diagnosis of arachnoiditis because it's not being looked for.
I have to say, sadly, a lot of MPs, and I freely admit that this was true of me too, until we're approached by a constituent who can explain to us exactly what the nature of the pain, the difficulty, the problem is, there is a huge amount of ignorance. Sadly, I think there's a lot of ignorance in the medical profession as well. A lot of GPs aren't familiar with the condition and the origins of it. So one of the things that we really do need to do is to have much greater publicity for everything concerned with it, the international debate that's going on about it, and that's why I think this video is particularly useful.
I love my bath, my shower. I love to look nice, I used to look nice. And now I can't have a bath because the water hurts my skin. It hurts. It's not just as cold as I have it, it's like getting into a boiling bath and it hurts my skin. So now I can't even have a bath in comfort. Without a bath. And I can't wash my hair. Look at me. I mean, look at me. I'm 53.
The most precious asset that any of us have is our intact nervous system.
It's me that's got the pain in the muscles in my leg. It's me that's waking up every morning and just lying there to wait for a leg to wake up with me.
They've got an ailment that nobody wants to acknowledge, and they're just castrated.
Once you have arachnoiditis, you have arachnoiditis.
Why should my wife have to go through this now? Why should Carol have this?
Admit arachnoiditis exists. Do you know, at times I despair.
While all these people are in their own state of denial, and while they're not being honest with themselves, how can they be honest with their patients?
subarachnoid space is that salum sanctorum. It is the most precious and fragile environment in the human body.